The CDC data just came out today. Secretary Kennedy mentioned at the hearing. We have 78% of adults with a chronic condition. That was under 10% in 1960. Most adults in this country have a full-born chronic condition. And nobody in the system, not doctors, not pharma executives, not insurance companies, are asking or taking responsibility on how to reverse those. Just as a fundamental statement of fact, every single aspect of the healthcare industry through, I think, not free market, but actually just totally bastardized policy and corporate capture, they're all profiting from us being sick. Pharma companies, 95% of their profits come from chronic disease management. These drugs, the blockbuster drugs, do not cure things. SSRIs don't cure depression. Statins don't cure heart disease. These new GLP-1 drugs do not cure obesity. So the entire market is around management. Insurance companies, thanks to Obamacare, it actually did this populist thing where they're only able to make basically a 15% profit margin. But they're able to raise premiums to get that 15%. They thought it was this populist thing. Oh, you got to cap the profits. But if you can make 15% only, and you can raise the pie, it clearly creates the incentives to have higher and higher premiums, which means not caps on people getting sick. So fundamentally, insurance companies, and I've talked to many of the leading insurance company CEOs off the record, they don't dispute this. They are incentivized for costs to go up and patients to get more sick.
Howdy, everyone, and welcome back to Moment of Truth, the podcast of American Moment. My name is Nick Solheim. I'm the CEO of American Moment, and I'm very glad that you've joined us this week for another fantastic episode. We had the infamous Calley Means, who is an SGE handling a lot of the MAHA portfolio. We had a fantastic time. He's really a great dude. It was actually my first time ever meeting him. We talked about everything from the COVID vaccine to the personnel shakeups at the CDC to why RFK wears jeans in the squat rack. So it was a very, very great episode. Don't want to delay it any further by flapping my gums, so we will go now to Calley Means. Calley, thanks so much for coming on the podcast.
Love to be here.
This is a bit of a letdown from the Tucker Carlson podcast, but I'm very excited to have you here anyway. For those of our listeners who have not listened to that great podcast, which I really commend your episode to them, tell us a little bit about your background, how you ended up, the great puppet master of
I don't know about that. Secretary Kennedy's unleashed something really special. It's been amazing to see, but my background is growing up down the street from where we are right now in Washington, D.C. And
really? You never meet D.C. life.
I was D.C., actual D.C. Okay. So born and raised here, grew up with interesting people around the table. And from a young age, I'm like, I'm going to be in politics. And that was my goal when I went to college. I worked on campaigns, worked at the Heritage Foundation, worked at the Bush White House as an intern. So that was my whole thing. And my first job out of college, I worked for the McCain campaign, McCain-Palin, spent 2 months, the final 2 months in enclosed spaces with Sarah Palin, and saw a lot of interesting things. Yeah. And did that for a couple of years, did public affairs consulting and worked for the food industry, worked for Pharma. Got out of that. It felt, didn't put all the pieces together, but it's a little dark, got into entrepreneurship. But a defining moment for me was, I went to business school, was running, started some companies. My sister, who is the pride and joy of the family, and we were both kind of bred to go up the traditional ranks. She was at Stanford Med School, surgeon, and she just told the family, almost completing residency, she's like, I'm done, I'm out. And she was crushing it. She, president of her Stanford class, Stanford Med School, top of her class, crushing in residency. She's like, it's dark, there's something wrong, I got to get out. And I actually yelled at her. I'm like, that's so stupid. Like, what are you doing? We actually didn't talk for a year. I was just like, well, you're going to be like, why aren't you got to go in the path? What are you doing? And she didn't have a plan really of what she's going to do. She's like, I need to step away from this. There's something bad happening. I need to figure out what's going on.
Roughly what year was that?
That was about 2017, I believe.
So it was a couple of years before COVID.
Yeah. So it was about 2017 and she went on a path. And for me, it kind of came together during COVID. I mean, COVID had an emotional impact on me. clearly some very dark forces were occurring. That fact that the government was able to lock our country down in a week, and the public health authority guidance, which was basically telling people not to ask questions. My sister and I were spending some time together, and I was really being impacted by her idea that there's an invisible hand of our healthcare system that is profiting from people being sick, and putting these pieces together and helping me put the pieces together of things I saw in DC where, we know a lot of people that work at pharma companies, know a lot of doctors, know a lot of people that work at insurance companies. These are not bad people, but really we think that the system itself is pretty dark. And what Casey helped frame from a medical perspective and I helped put together from a political perspective is it's really just the invisible hand of incentives. I went back to when I, worked with pharma and worked with food companies, and fundamentally, working as a pharma lobbyist, a pharma consultant, you're not asking how to reverse the chronic disease rates in this country. The CDC data just came out today. Secretary Kennedy mentioned at the hearing, we have 78% of adults with a chronic condition. That was under 10% in 1960. Most adults in this country have a full-born chronic condition. And nobody in the system, not doctors, not pharma executives, not insurance companies, are asking or taking responsibility on how to reverse those. Just as a fundamental statement of fact, every single aspect of the healthcare industry through, I think, not free market, but actually just totally bastardized policy and corporate capture, they're all profiting from us being sick. Pharma companies, 95% of their profits come from chronic disease management. These drugs, the blockbuster drugs, do not cure things. SSRIs don't cure depression. Statins don't cure heart disease. These new GLP-1 drugs do not cure obesity. So the entire market is around management. Insurance companies, thanks to Obamacare, it actually did this populist thing where they're only able to make basically a 15% profit margin. But they're able to raise premiums to get that 15%. They thought it was this populist thing. You got to cap the profits. But if you can make 15% only, and you can raise the pie, it clearly creates the incentives to have higher and higher premiums, which means not caps on people getting sick. So fundamentally, insurance companies, and I've talked to many of the leading insurance company CEOs off the record, they don't dispute this. They are incentivized for costs to go up and patients to get more sick. And then hospitals. Hospitals do not make money, as my sister learned at Stanford Med School and in residency. Hospitals do not make money when the beds are empty. They make money when the beds are full. Yeah. And Casey felt a lot of pressure when there was a borderline surgery she needed to do. She was told, you do the surgery. You eat what you kill as a doctor. Your pay is based on how many surgeries you do. And we have a cascading amount of medical interventions. So I saw it on the public policy side. She saw it on the medical side. My mom became a case study for us of what happens in the medical system because she got a diagnosis of pancreatic cancer and she died a couple weeks later. And at Stanford Hospital, when my mom went to the Mayo Clinic, she went to all the best doctors in the world. They said it was a tough break, but my mom had 5 other comorbidities. She was on that statin, the metformin, the ACE inhibitor for high blood pressure. And it became really poignant to me from Casey's view of the medical system. Wow, what if when she got that statin prescription 20 years ago, and she had high cholesterol, it was a 5-minute appointment. Go on your way. Most people have this condition. Most people are on statins, no problem. What if it was actually spurring? This isn't partisan. It's just like curiosity about what she's eating or what's actually causing the high cholesterol. So my sister and I wrote a book that got the first person to reach out was Tucker Carlson. His producer DM'd me, started going on podcasts. I became very passionate about communicating this to conservative audiences. It's a very bipartisan message. I mean, what Secretary Kennedy's saying, you close your eyes, you don't know if it's Democrat or Republican. We're fundamentally talking about sick kids, healthy food, exercise, sunlight. But I felt there was something happening after COVID where Republicans and conservatives, and I saw it resonating on Fox and with Tucker, with Megyn Kelly. I think a lot of people woke up and realized the experts are really wrong and realized there's some dark forces around children's health. And I do think that children's health was what really motivated it. So this political momentum. At the same time, you had Secretary Kennedy at one point getting 20% of the vote as an independent candidate. Yeah. And I would go to his rallies. I was a Trump supporter and was working with some folks on the Trump campaign. I mean, Vince Haley reached out early in the campaign. And there was an energy to this issue. Everyone was trying to figure out how to articulate chronic disease. And President Trump, well before the Kennedy endorsement, made very strong statements about it. But I saw this energy happening. I talked to a lot of Kennedy supporters. I would always ask them, would you support President Trump or Biden or / Kamala if you had a choice? and they all said President Trump, but they did not look like Trump voters.
Right.
But they said President Trump, relatively authoritatively. So that was in my head. And you couldn't talk to people on a campaign because, as you know, when you're running for president, you can't talk plan B. But everything was shaken up, I think, the day of the Butler assassination attempt. It was very poignant for me watching that, thinking about Secretary Kennedy with his history of assassinations. And I impulsively called Secretary Kennedy, gave him this idea. He prayed on it, thought about it, was thinking the same thing as a unity. And I had a small seat into watching their conversation develop. And I'll tell you, like, that was a 2-hour conversation the first day. They had many conversations thereafter. I think they both see themselves and the cultural opportunity to drive historic transformational change. That's what they bonded over. It wasn't over politics. It wasn't over polling.
Yeah.
And I think that what happened a year ago, and it was just a year ago, I think that bond, that unexpected partnership that they've made, I think it's changing the world. I think it is absolutely, nobody could imagine the success it is having to where today President Trump and Secretary Kennedy, they're by far the 2 most popular public officials in America. I think there's an awakening of voters, of women, of independents, of young people. But if I've made any contribution, it was getting this mission from my sister, which is daunting and is really complicated and is existential, but it deals with our healthcare incentives, our food incentives. It's almost impossible to fully comprehend. And with my DC training, with my, political experience, I'm like, how do we make this bite-sized? How do we compel voters with specific issues? Because I think with an issue so complicated, you've got to start just identifying the macro problem and getting wins. And I think we've gotten a lot of wins. Food dyes and reforming the GRAS standards of the FDA, which is the food industry used to just self-police, SNAP reform, taking soda off SNAP, some common sense things on the corruption and vaccine injury acknowledgement. I mean, there's a lot of things that are happening in just 6 months that I think are really profound that start making the case for wider reforms that we need to have.
Yeah, there is so much good stuff there, but let's start with the coalition that's
Yeah,
been built. I mean,
right.
my sort of opinion on this has been the MAHA and MAGA coalition is probably the greatest political coalition that has existed in the last century.
I think so.
Can you tell us a little bit more about how exactly you teased it a little bit, but how exactly that came together in the
Here's
wake of
how
the
I thought about it.
assassination?
Here's how I thought about it is that the Democrats have kind of been the party of, when you think organic food or healthy food, when you think children's health, even the vaccine and pharmaceutical questioning, that was an elite left-wing thing. So, kind of distrusting the experts. A lot of things flipped during COVID. And President Trump has quite frankly shuffled the decks on a lot of issues. So I was thinking about this pain people are seeing and the pain I'm seeing with my mom and about to have my wife having our first child. And, 38% of teens have prediabetes. We're the sickest country in the developed world. Every single parent, it doesn't show up in polls, but, their biggest concern is children's health. You go into a classroom, 50% of teens are overweight or obese. So there's something there. And I kept thinking, this isn't innately partisan. And as I said, I really was like, how do we get conservatives riled up on this? How do we get voters riled up or independents? And there were a couple constructs. It's like, well, Michelle Obama talked about soda taxes. We don't need to talk about taxes. What should we talk about? Oh, interesting. We spend so much money on this crap. It is totally just bipartisan, ideologically consistent with conservatives. If we're going to have a SNAP program, $120 billion, why are we spending 15% of that on soda and 70% of it on junk food? So wait a minute. We're spending tens of billions of dollars to literally give crap to lower income kids that then jack up Medicaid rates because 90% of them are on Medicaid and we're going bankrupt for Medicaid. It's like that's not conservative at
It's a
all.
self-perpetuating system.
Transparency. So,
Yeah.
so 2 frameworks I really push was think about where we're spending money and then think about transparency, patient information, reducing corporate conflicts. That gets into something we're doing on food labeling. I don't think, having good labels on food is a necessarily, to me, that's a very conservative principle. There's coming up with a policy platform around transparency, around corporate capture, around Gold Star Science, around where we spend money, government procurement, and then realizing that the Democrats made a drastic political mistake where they become the party of experts and they've basically turned a blind eye to the obvious reality of what's impacting American health.
You had to put experts in quotation
Yeah,
marks.
exactly. They've turned a blind eye to what's just obvious, which is that we don't have a health policy problem, really. We don't have a problem with the, finite, the marginal Medicare or Medicaid billing rates, or, really what we talk about often in, conservative seminars on, what's the perfect marginal change to healthcare policy. We have a problem that Americans are too sick.
Mhm.
Europe has terrible public policy with healthcare. Terrible. Socialist, terrible. We'd never want to emulate it. They spend 3 times less on healthcare per capita and live, in many cases, 7 to 8 years longer. It's not because they have a good healthcare system. It's because they're less sick. It's because they're less poisoned. It's because they actually, in many cases, spend 2 times more per capita on food and just culturally value that. There's some
Yeah.
cultural, spiritual, almost issues here, that there was a political opportunity to tap into. So, Secretary Kennedy was proving that he was tapping into that, proving he was tapping into that with independent voters, and those independent voters were malleable. And I saw, as I said, a lot of people at those RFK rallies that wouldn't have considered voting for President Trump, but many of those people with this unison. We had an event at the Heritage Foundation right after the election. It was all these hippies.
Yeah.
They weren't reluctant voters for President Trump. These are real voters. They made their first vote Republican, and, by unleashing this issue and getting wins on it in a way that has actually really excited conservatives too, because nothing's not ideologically consistent with conservatives, we're getting full support from Freedom Caucus, full support from conservative groups. The only opposition we're getting is from corporate funded type people. This is an issue that is ideologically consistent with conservatives and brings those swing women, swing young people into the fold. And all I'm thinking about, to be honest, my goal in life is to reform our healthcare incentives. Um, but the way we do that is just keep winning and keep this coalition alive and make it a lasting coalition inside the MAGA coalition. There's so many people. We talk about this all the time. There's so many people that want this to be fake, that want this to be a flash in the pan. It's not. I don't think it is.
Yeah.
As I said, the polling on these issues is over 90% for almost every issue we're doing. The relationship between Secretary Kennedy and President Trump is very strong. And I just think the public energy around what Secretary Kennedy is doing is higher than ever. So we want to maintain these voters, and as you said, I think it is one of the most significant political shifts in American history. I think it can be that.
Yeah. You were talking about the insurance companies a
Yeah.
couple minutes ago, and maybe this is anecdotal, but a lot of the guys that I talk to that are married and have kids, their top two concerns with the way that America operates right now is housing costs and how much it costs to insure their families. What are the incentive structures of? I'm setting you up. I'm teeing
Right.
you up for this one. What are the incentive structures for a lot of these insurance companies in particular?
Yeah. So, as I said, the fundamental incentive of insurance companies is for us to be sicker. And there's really no cap on Medicare or Medicaid expenditures because, I mean, literally, the Affordable Care Act made it unable to be for drug prices to even be negotiated. President Trump's trying to really fix that, but that's why drug prices for many leading drugs 10 times more in the United States than in Europe. So there's an insurance CEO, fundamentally their economic incentive, and they wouldn't dispute this, is for Americans to be sicker. So they are paying out more because, again, if you're paying out more, you're able to raise premiums the next year and get that 15% that you're owed in Obamacare. So if you're able to raise premiums, get 15% of a larger pie, that's what you do. And that's the fundamental problem, and why healthcare premiums have been the single largest source of U.S. inflation. They've more than doubled since Obamacare, been an absolute disaster. When we think about how to solve this, because the expense on healthcare is, I think the biggest economic issue in the country because it's the biggest part of our budget. 27% of the federal budget. I believe defense and intelligence is 12%. It's growing much faster. It's the biggest out-of-pocket expense for Americans. It's by far the leading cause of bankruptcy, over 50%. What we're talking a lot with Dr. Oz and Marty McCary, CMS and FDA, this incredible team that talks like 5 times a day and is just trying to figure this out.
Both very smart guys.
Really smart guys. And this isn't reflected in policy like immediately, but what I think the legacy agenda we have, and I think the energy, if we can keep pushing on this, it will come through to voters in the next 2 years, is that if we lower obesity and diabetes rates in the United States to European levels, so we are double right now. We're double the obesity rates and double the diabetes rates than many European countries. We cut 1.5 trillion at least from the budget every year, and the amount of economic productivity from all of these people that's causing all these economic downstream effects are almost incalculable.
Yeah.
So I think the only real way to change it, again, it's some healthcare policy changes, but we actually just have to get Americans less sick. When you're plugging into the system a population that's 2 times more obese and 2 times more diabetic than any other developed country in the world, um, that's to me what the core cause of this healthcare increase is. Now, the medical system from the NIH, the FDA, the CDC, which is a basket case, insurance companies, pharma companies, hospitals, who all are incentivized for us to be sick just demonstrably, they've let us down. So, I do think this comes with cultural shifts. It comes with conflicts of interest shifts. It comes with getting corruption out of the NIH and having the NIH actually studying why we're getting sick to substantiate thousands of studies about the root cause of issues, which then eventually has to make it into standard of care, which CMS then changes. So we have better incentives in our healthcare system. There's a whole plan to do that. It is a 10-year plan. This is re-steering a ship that's the largest industry in the country.
Yeah.
So right now, it's wins on that issue. It's foundational reforms. And I don't undercount. I think the greatest accomplishment of the Trump administration on health and of MAHA in the next 4 years is that we're legitimizing this conversation. And, as you were alluding to, I think, before we went on, I mean, I just think moms particular, just having a lot of conversations, reading labels, thinking about more what they're giving their kids. The greatest pride I have is when people tell me they're going to their local school and just demanding better food. I mean, there's just micro things happening that is going to improve American health. And I think if it compounds, actually bend the cost curve of health more than we would ever project or expect.
Yeah. No, I think that's totally right. You were talking about some of the, external opponents that you guys have been facing, a lot of the moneyed interests. You've also had a lot of problems internally with career staff at a lot of these agencies. There's been a lot of media reporting about this. They're saying that you guys are evil for getting rid of these experts. What's actually going on?
Well, I am really grateful for what happened at the CDC this week.
Yeah,
actually, I actually, it's been a turmoil, but I actually think this has been one of the best weeks ever for American health, for Secretary Kennedy, for President Trump's agenda on health, because the CDC director was just flatly insubordinate. She literally told Bobby, "You can't trust me." She refused to consider a flawless, peer-reviewed research on vaccine injuries and the vaccine recommendations, which everyone would just expect you to do. She refused to fire intransigent staff, Trump-hating staff. I mean, she was doing things anyone would fire her. And then a person under her, his first name is Dimitri. I always butcher his last name, but you've probably seen pictures of him. He's the one that on Christmas Day last year had a devil worshiping ceremony. He appointed himself, and the media appointed him the spokesperson for science. So he went on 30 news programs in the past week, billed by the New York Times, by This Week with George Stephanopoulos, by Meet the Press, as the spokesperson and the preeminent scientist in the country. This guy was the second ranking at the CDC. He was in charge of all vaccine programs. This guy, in his statement, said that it is anti-science and Trump is evil for using the word mother and not using the word birthing person. And he's deeply opposed to the Trump administration's efforts to end child mutilation, which he thinks needs to be, he probably agrees with the American Medical Association that a 2-year-old can go through gender-affirming care. But he that was a core reason. He also literally covered up and helped obfuscate data, which is coming out. He's a radical. He hired a Democratic Trump-hating law firm. They had them on retainer before he even got fired. But this is the type of person we're dealing with. And I, don't mean to be too facetious, but it's literally demonic forces. I mean, this is a guy that posted 20 pictures with devil symbols, literally devil symbols.
I'm just laughing at the irony of the representative of science worshiping the devil.
I mean, he posted dozens of photos worshiping the devil.
Yeah.
And in his official capacity under President Biden, he was the monkeypox czar. And he went on news programs in his official capacity saying that for him, gay orgies are a normal, he said, use the word normal Friday night activity.
Yeah.
And we shouldn't stigmatize the monkeypox. And because of this ideology, He actually didn't explain how people got monkeypox, insinuated that kids could get it, and schools started shutting down because he didn't want to stigmatize the issue and actually say the truth about what happened. This is
Yeah.
the type of leadership we have in science. And I'm grateful because I literally couldn't believe it. I'm like, wow, we have the spokesperson on their side against Secretary Kennedy is a literal devil worshiping pervert um, who is totally outside the scientific consensus on almost everything, including his main complaint about Secretary Kennedy, which is taking the COVID vaccine off the CDC schedule. Now, they're trying to drive a wedge between President Trump and Secretary Kennedy on Operation Warp Speed. Secretary Kennedy said today, Operation Warp Speed was a miracle. But President Trump calls Secretary Kennedy all the time and says science evolves.
Yeah.
This is the most pro-science administration in history. President Trump is fully supportive of Bobby having fearless science out there and evolving recommendations as that research comes. And right now, 90% of parents in the country are rejecting the CDC's previous guidance on the COVID vaccine, not giving it to their kids, and 85% of healthcare workers rejected the CDC guidance. So the CDC is arguing for a policy now. They're saying Bobby's anti-science for taking the COVID vaccine off the recommended schedule. It's still available for people, but it's off the recommended schedule. They are putting their hat on an issue that 90% of parents and 85% of healthcare workers have already disagreed with. So, that's kind of what we're up against. And I think the choice is clear. It's do we want reform that the administration is trying to drive, which is inevitably going to be messy, but is needed? Or do we want the status quo when it comes to health when we are the sickest country in the developed world and just came off of the COVID response, which was a disaster?
Yeah. It is really helpful. I'm just still thinking about this, that our enemies are actually evil.
Demons.
Like,
They're literal demonic forces.
It's very helpful for our
Yeah.
case. Can you tell me a little bit more about, I haven't paid nearly enough attention to this, but how the science has evolved on a lot of the COVID vaccine stuff?
Yeah, again, this is fully believed by Secretary Kennedy, is we had a pandemic. President Trump was getting a lot of actually incorrect information, as he'd say now. He was getting incorrect information on China. He was getting
Personnel is policy.
they were saying, oh, don't say that's racist to say it comes from China. That was true. He was getting, I think he's, has said more and more, getting some incorrect information from the pharmaceutical companies, but very uncertain time.
Yeah.
And the marshaling of resources to create the COVID vaccine was it was one of the greatest mobilizations in American history. And as Secretary Kennedy said today, the COVID vaccine did match up better with that initial strain of COVID. But the strain changes, we've learned that Pfizer and these companies, they were rushing quickly, but there's some information they've potentially even covered up. More information has come up. The CDC, including some of these people who've been fired or resigned, the congressional oversight released this. They knowingly covered up risk of heart issues for children, particularly young boys, in 2021, 2022. We also learned more information. I had to check this 3 times talking to people at HHS. There is not a healthy child on record who has died from COVID in the last 2 years.
Yeah.
Not one healthy child. The only children who have died were massively had comorbidities with other conditions. Not one. So if not one child literally has died from COVID in the last 2 years, what's the risk benefit analysis on that? We know that information now.
Yep.
And you shouldn't always be going with what people are doing, but how can the CDC expect to have legitimacy when, again, over 90% of parents have already made this decision? Already 90% of parents have rejected the CDC guidance. So this cynical ploy the Democrats were throwing up, we are nominating President Trump for the Nobel Prize. You're going against President Trump, Secretary Kennedy. It's like, not going to work. Not going to work. We're proud of Operation Warp Speed. We've learned more information, and we're proud of science being an evolving process. As Secretary Kennedy said today, we're doing 2 things. We're restoring back to the basics on why we're getting sick. We're talking more about food. We're talking more about exercise. We're also unleashing innovation. There's going to be incredible innovation. Marty McCary at the FDA this year will approve more drugs than any FDA in any year in American history. They are going to have, I think President Trump might have a cure for cancer. The Democrats will still attack him for it. We're going to have breakthrough therapeutics coming. I don't know what's in the pipeline. I'm just saying, I think we are going to have breakthrough therapeutics coming. So yeah, there's no daylight here. And I think we all feel this, right? That we were misled a little bit on the COVID vaccine. We were misled with the CDC recommendations on lockdowns. And I think the simple step of taking that off the recommended schedule, which then translates into mandates. I
Yeah.
mean, before this move from Bobby Kennedy, in many states, you had to jab your child for preschool with the COVID vaccine. I mean, when they can't even, when there's really limited risk of having COVID as a child. So I think we stand on very firm ground here. I want everyone to know when people say Secretary Kennedy is assaulting science, killing people, the only proof point they have is that decision on the COVID vaccine. That's it. That's the
Right.
only thing they talked about at the hearing today.
Yeah.
That's a decision 90% of parents agree with.
Yeah. Tell us a little bit about that hearing today, by the way. You've referenced it a couple times. I was watching it before you came in, but
Yeah, I think the Democrats,
why is this happening in the finance committee, by the
well,
way?
is interesting. So HHS is the largest budget of any government department in the country, in the world. And because CMS is the largest sub-department of any agency, $2 trillion, it deals with a lot of financial stuff. So
Okay.
because of some of HHS's purview, it has oversight from the finance committee and the health committee. It's one of the few
Yep.
departments that has that. So Secretary Kennedy has the privilege to be able to be called by two different committees. I think this CDC decision and kind of what happened today, we're really at a defining point in this journey of MAHA, and I think it's a real turning point. Um, the Democrats acted like the status quo is fine. The Democrats pounded the table, yelled and screamed with the fundamental argument that Bobby Kennedy is upsetting the status quo when it comes to American health. I just can't repeat this enough, but we have 40% of teens pre-diabetic. We spend 3 times more, live 7 years less than almost every other developed country. We had a Chernobyl level breakdown when it came to CDC guidance and public health guidance on COVID that, led to, bad recommendations and lockdowns that have led a generation of kids behind. We have rank conflicts. We have clearly a system, and again, I think this message is hopeful, but I believe this is existential. I think a lot of parents believe this is existential. We need a change. We need a grappling with what's happening. That's what Secretary Kennedy is saying. And the Democrats berated him for seeding distrust in science. And he made the simple point, and I am very comfortable with this point being in front of the American voters. Are Secretary Kennedy and President Trump the reason people have distrust of science, or were they elected to fix the problem and are working their ass off to fix the problem?
Yeah.
And it's just such a disconnect with, honestly, just personally, just seeing Secretary Kennedy every day and seeing him at meetings just talk about how do we get kids healthy, and seeing his conversations with President Trump that are so pure, and seeing Marty Makary and Dr. Oz and Jay Bhattacharya, my sister Casey, who's the greatest human I know, who's getting, savagely attacked. Seeing the energy behind this movement and the push and they're warriors for changing this broken institution at HHS, and then the Democrats saying that Bobby Kennedy wants kids to die, and just the vicious attacks.
Yeah.
It's expected. It's fine. This is showbiz. It's politics. But I think importantly, I don't think it's going to work. I
Yeah.
just think the energy of Secretary Kennedy with the full support of President Trump, it's just I think we're on track to have profound impact on the midterms. And I really do think voters are assessing the Democratic behavior and assessing the fact that Bobby Kennedy's being slandered relentlessly, but looking at what's actually happening, both culturally and from policy. I think we're only going to grow the movement from this behavior with Democrats. If they were smart, they would be partnering with Bobby Kennedy, but they're not that smart because of Trump derangement syndrome.
Yeah. No,
Yeah.
I totally think that's right. One of the president and the vice president's big priorities has been tackling the opioid epidemic. I was wondering if you'd be able to talk about that a little bit, and sort of what y'all's priorities are there in terms of solving that.
Yeah. We actually, Vice President Vance has been closely involved with Jay Bhattacharya and Secretary Kennedy on some recent initiatives on opioids. We recently, just very specifically, there's a type of opioid that's I'm going to butcher the name, but it's being sold at these vape shops all over the country. That it's actually an epidemic. Marty Makary just announced a policy on that, but um, I think the opioid crisis is really representative of what we're seeing in a lot of cases where the medical community was all hands on deck to say that they were safe. I mean, just specifically, and I actually helped work on this early in DC. The dean of Stanford Med School in 2009, I believe, was a pain specialist, was paid $3 million uh, by opioid companies in a donation to research and then personal payments directly from opioid companies. And then he was appointed to the NIH Commission on Opioids, where he appointed his friends, the majority of which had direct conflicts, were directly paid, that recommended around 2010 that opioids weren't addictive and to keep prescribing. And it's funny, I mean, that led to so many deaths. This happens, it just happens again and again. This is what's happening. It's just a rigged system. You're able to just directly pay the professors. You have them on the NIH, the CDC guidance panel. That puts something out, and then all the Democrats say this is unimpeachable science. It's all, and then of course Elizabeth Warren's being paid $1 million. It's a very simple game, but that's what happened with opioids. So I think
these companies know that they're
yeah,
addictive,
and
right?
I don't oh yeah, they have research on it. I mean, I think, and this is all complicated. I mean, there's a similar thing happening on GLP-1s where they're trying to make, I think a drug that has, it's complicated and certainly people should evaluate it and it's good in some cases, but they've bought off every obesity researcher in the country.
Yeah.
To the point that you had the top obesity professor at Stanford. Excuse me, her name's Fatima Cody Stanford. She's at Harvard. She is now saying the standard of care should be that obesity is genetic, and that you need to give Ozempic directly to a child the second they get obese. That's literally Harvard. That's Harvard research. And now we're being attacked for being anti-science, for saying that obesity is tied to lifestyle. And there's a tremendous pressure on HHS to approve Ozempic for as young as 6.
Yeah.
So that's how it works. I take a really practical view on this, and I try, like, I see my role as just like existing in the world that is. Like, this is a big issue. We're talking to the opioid makers, to the GLP-1 makers, to everyone, because this is complicated. It's like the whole US economy, or at least half of it when you talk about pharma and food and healthcare. And I try not to take the dark tactics personally. I mean, they're paying people to attack me, to attack Bobby, to attack my sister, to attack Marty, to attack Dr. Oz. We're meeting with them and they're paying people on the side to do all this information warfare. It's fine, honestly. It's fine. Like, I think that's a pragmatism Bobby brings to it, and a pragmatism we're trying to bring to it is like, now Secretary Kennedy is in the seat of power, and this is not going to be radical change. I think hopefully there's a radical cultural awakening, but we've got to figure out, because the individuals at these, again, it's a visible hand, the individuals of these companies, they fundamentally agree with the 10-year vision we have, where we have a different system that has healthier kids, but there's so much money at stake, and it really does blind people to, I think, perform pretty evil actions, but it's happening at all levels all the time in this town.
At a very large scale.
Yeah. But on opioids, there's been a couple actions, and there is some, I don't know what's been announced, what hasn't, but there's a whole suite of activity I know is being contemplated to continue to address that issue.
Yeah. I suppose really what I'm curious about in that is, you can solve the incentive structure, right? To make it so that this doesn't happen again. But is anybody going to pay the price for what they've done to these families in these parts of the country?
Yeah, I mean, I think about this a lot. It's funny when President Trump signed the pardon for, or sorry, when President Biden, in anticipation of President Trump, signed the pardon for Dr. Fauci, a part of me was really upset, because I do think accountability is really necessary, and I think he is a historically bad figure. But a part of me was like, oh, maybe that's a good thing, because we can focus on the future. And we only have limited time. There's a lot of work with the Justice Department right now, and I do think people need to be held accountable. In some cases, though, I mean, let's take.
Well, a lot of what these companies are doing is not, strictly speaking, illegal, too.
Yeah,
part of this.
Yeah, what a direct illegal actions. This is my general framework. Direct illegal actions need to be completely held accountable. Like, direct individual. When it comes to pointing fingers at the disastrous state of U.S. healthcare and the orgy of corruption and disastrous outcomes, it is an invisible hand of thousands of micro steps between government, between industry, in culture, in the media. that has gotten us to this point. So my general philosophy as we're engaging with people is as much as possible, kind of let's look forward. Because even with food companies, like, is it whose fault is it that we have 10,000 chemicals in our food that aren't banned
Yeah.
in any other? That excuse me, 10,000 chemicals in our food in the U.S. that are banned in every other country. Whose fault is that? Well, the food companies lobbied heavily to the FDA and other agencies to rig the standards to allow them to self-police. They bought off academic research to where almost 100% of the research on these food chemicals is produced by industry, saying that drinking petroleum-based food dyes, literally crude oil for kids, is healthy. That's a problem. The FDA, which was influenced by industry, was, made the wrong decision, so they could point at the FDA. And so the FDA's gold standard, they're saying, so government's accountable. It's kind of a hand-holding exercise between the government and industry and other forces. So with an example like that, I don't really care about looking backwards too much. I don't really
Yeah.
need to hold. I mean, if they were following the laws, they helped rig the laws. I think in that case, if they're worried about retroactive liability, I'm not a fan of giving anyone liability protections, but it's like the message has kind of been with the food industry. Okay, let's improve it now. And that'll be a mutual win. And it has been actually. I've loved it that the food industry is doing incremental moves. None of these moves have been coercive. It's been incremental. They've
Yeah.
been responding to consumer demand. And then I look on the social media posts and people aren't like, oh, the Fruit Loops are evil. It's like, it's actually like, hey, thanks for taking this step. Like, thanks. And then if we can keep taking those steps, we'll be at a better place. So
Yeah.
that's my general, I'm meeting with pharma, meeting with pesticide, folks, meeting with farmers who, are vital parts of the solution, meeting with insurance. It's like, we've got to have dialogue because we all agree where we're going to get to. And we all pretty much agree that the system is bad and it's nobody's specific fault, but they're also protecting their interests. And I think they feel the weight of tens of millions of employees
Yeah.
because unfortunately, healthcare is the largest employer in the country.
Yeah. You brought up
Yeah.
GLP-1s a few minutes ago. I don't own a TV, but my guilty pleasure is the MLB app on my phone. I watch a lot
Right.
of
Sure.
baseball, and every single ad that I get is either sports betting
Right.
or GLP-1s. And I know a lot of people, in the MAHA movement have been, really focused on getting some of these coercive ads off of TV. Is that something that we could see in the future?
All I can say is President Trump has talked about that. Secretary Kennedy has talked about that. It's pretty staggering. The degree of overprescription in this country, we're one of, if not the most medicated country in the world with the highest rates of disease. I really look at it through a patient safety lens. Um, there was a rule change in 1997 that basically a loophole where we don't even get on those social media ads any side effects, any informed consent.
Right.
It creates a situation where patients are going without informed consent, pressuring their doctors. The doctors are paid on satisfaction and short meeting appointments, and it's a problem. So, what I can say is obviously that's something Secretary Kennedy, President Trump's talked about, and there's very serious consideration of that issue through the lens of public health. It's a free country. We've got the First Amendment, but there is a clear legal, I think, imperative and moral imperative that, particularly with drugs, that patients are not misled in a dangerous way. So we're looking at ways we can do reform, and hopefully we'll have something soon.
Yeah, I mean, the reason they do that is because it works,
Right,
right?
right.
Like, they can just go say, You're fat and now you're not." There
Well,
you
on that
go.
ad, that's what the ads say.
Yeah.
They market it to 22-year-olds as this magic pill, and there's a mass class action lawsuit right now on Ozempic. It's there's warnings in Europe about suicidal ideation, blindness. I mean,
Yeah.
these are like major like risk indicators. So again, like I think spiritually, it's a bit of a problem because we all know intuitively there's not a magic pill for something like that,
Well, and
and
you can
then
always tell too when somebody's on it and
right,
you look
right,
at them,
right.
you can tell.
Yeah, it's like if you could show me data that this is a magic pill, you could just jab yourself, continue eating crap, not exercising, you'll be perfectly thriving and healthy for the next 50 years. Like
Yeah.
that'd be interesting data. I've seen none of that. Um, so I'll just back up and say this is how I see HHS and the administration looking at a question like that. The other side's kind of command and controlled a lot too.
Yeah.
We're not like, don't take Ozempic, take this. It's really it's like everything is like, do patients have the correct information? And then is there correct consumer choice? I mean, right now in Medicare, Medicaid, and insurance, you're kind of like, it's kind of jamming people into a specific standard of care. Like I liked that the Big Beautiful Bill had more like HSA type stuff, more consumer
Yep.
directed payments. It's like, I do think you solve a lot, and this is the long term strategy. If you give people the right information where you're not infantilizing them, where you're not assuming Americans can't see conflicting information, give them the right information and then let them choose their doctor. It's pretty simple, but that's not what we do right now. We think the Americans are babies who literally the CDC covers up information on the COVID vaccine because they don't want to trick anyone or confuse anyone out of their ideology, even if that information is useful for certain populations. And then, we mandate and basically have money only go to the preferred solutions, which aren't even necessarily science-based. So those are the two things: informed consent and then patient choice.
Yeah. I'm thinking a little bit about, the MAHA coalition. There are people like my wife, as an example, who's disappointed in me when I forget to buy organic bananas at Walmart. And then there are people like, I think Tucker is actually a really good example of this, who like loves a cheeseburger but would have liked to have killed it himself. What is your message to people like that who still love like a cheeseburger and French fries? It do these two flavors of Maha go together?
Oh, 1,000%.
'Cause I still love a good
No,
cheeseburger.
1,000%. My sister Casey talks about this a lot more eloquently, but we're talking a lot about how we don't have this isn't a tactical issue. It's not about, doing the 10 minutes of cold plunging and then, the 39 minutes of the sauna and then eating this super prescribed diet. I do think at the end of the day, and I think what's happening around the country is it's actually more of a root cause cultural shift in mindset to
Yeah.
having more respect to what we're eating, more awe of what we're eating, doing a little bit more research about where our food's coming from, potentially having some more blood tests or sensors to understand, what food's doing to our bodies when we have a health issue like eczema for our children or, you know, pregnancy issues or anxiety, these things we all face. Not just going straight to the pill, but actually figuring out the root cause. I can't tell you how many parents with the eczema with their kids.
Yeah.
They're drugging their kids with all this stuff, all the creams, and then they figure out, the microbiome and a potential probiotic. I just think it's thinking root cause and thinking about kind of what you're eating and be just more mindful of that. I mean, I do think that mindset. It's not like following a prescribed thing. Casey and I wrote a book, with detailed information, and there's a lot of resources out there with detailed information about how to think about your diet. Trying to have some of the most egregious crap out of the house. Shift to better oils, things like that. There's a lot of resources for that. But I do think fundamentally it's just kind of a more of a mindfulness shift. And I'll just say one of the proudest accomplishments I think of MAHA for me too is I hear from doctors all the time. They're furious with me because they say that patients are asking more questions.
Mm.
Um,
Shame.
yeah,
Don't
yeah,
ever do that.
and I think it's this big dermatology clinic friend that runs it, thousands of doctors. She said everyone's so upset with MAHA because 5 years ago everyone just got their skin issue and got the pill as a 5 to 8 minute appointment, and now like 80% of patients are asking like what the natural cause is, and
Yeah.
she's like, it's so ridiculous. These people aren't doctors, and I'm like, well, are these like metabolic issues, like food based issues? Can you reverse them like through like
Yeah.
root cause? She's like, yeah, yeah. I'm like, well, why is that a bad question?
Yeah.
So I think that kind of awakening is a good thing. And often it is like, having a fertility struggle or having battling obesity or prediabetes or, anxiety. Like a lot of a lot of people are now suffering from autoimmune conditions. I hear from people all the time that actually them having some lower grade, not life threatening health issues was the best moment of their life because it spurs them on this path to kind of ignore the medical system. And that's a clear MAHA message. I mean, I'll say it is that when it comes to chronic conditions, you are on your own. I mean, I really, consult your standard of care, obviously listen to your doctor, make your own decision. But we are on our own when it comes to chronic disease management. We're not
Yeah.
getting the right and I think it's one of the first administrations in health that's really trying to reform, but not just being the water carrier for what is a broken standard of care and a broken structure, just demonstrably with the outcomes. But I think people should really do their own research when it comes to a chronic condition for you or your kids.
Yeah.
Yeah.
No, I totally agree with that. I think one of the things that a lot of American adults struggle with as it comes to this health stuff is it becomes a lot harder to be healthy when you're a parent.
Right.
And I think some of the most compelling kind of get off your ass thing for this is hearing how somebody else does it really well. So what do you and your wife do? Workout regimen, what you guys eat?
What you're it's I've been joking a little bit with my wife. I'll be honest with you. I've been battling 16 hours a day at the White House, and
Yeah.
I'm off the MAHA habits for
Yeah.
the past couple months. Um, I think exercise is vital, and there's no excuse for me. But like, I
Yeah.
think you've got to stay to the basics, which is 3 to 4 days of exercise, and then predominantly whole food diet. And then I really recommend things like Function Health have no relation to that, or some kind of functional blood testing service. And you figure out what your nutrient deficiencies are and can potentially supplement nutrients and vitamins for that. There's a lot of talk about whether it's grifting or whatever to do supplements. I think the key thing is that our food is less nutrient dense now. Like tomato, even organic tomato, has 50% less nutrients in some key categories than it did 50 years ago because of what's happening to our soil. So actually understanding how to plug some of those nutrient gaps that are pretty specific to each person, and practicing a mindfulness and or prayer, obviously, which has huge health benefits from a lot of research. But that's where we talk about good energy, and I think it's grounding in that. I think I've been grounding myself, and I've been so grateful to be on this fight, forgiving myself for not always, you know, living the best stress-free Maha lifestyle right
Yeah.
now. But it's really grounding in those basics.
Yeah. Are you also a nicotine user like the secretary or no?
I'll just say Tucker is an asshole and shipped a crate of his product
I also got it.
to Dr.
He sent me a
Oz's
bunch.
house. We had Dr. Oz and Secretary Kennedy and everyone and living at Dr. Oz's house during the transition, and there was a crate of Alp delivered.
Yeah.
So I'm not going to comment on who did or didn't partake in that, but there's a lot of Maha people that Tucker has influenced.
Yeah. What is the general I don't know if you have one yet, so I suppose you can decline to answer, but the general HHS view on like nicotine pouches, products, etc.
There's not an HHS view on it. I mean, Marty McCary just posted an update yesterday. There's some various companies in backlog of FDA approval.
Yeah.
My personal opinion is that a lot of health influencers seem to like it. So there's a lot of positive things going. I don't know if that's from the data or just that people are
That
kind
it
of
rocks.
affirming their own bias. I think there's definitely some interesting positive data, but I think this idea that there's almost no risk or low risk is hard for me to believe. Kind of like Ozempic, it's like there's kind of a common sense filter where whatever the study says, it does raise your
Yeah.
blood pressure and heart rate a little
Yep.
bit. So it is becoming a lot more popular, but I think there is I would have concern and just the obvious addictive quality of
Yeah.
it.
But it's so great.
e-
I mean, look, I used to work for years, for 6 years. I worked on a hog farm and I used to dip
yeah,
way better than dip.
no,
You can at least give me that.
well, no, well, Bobby Kennedy said this recently that they're again, we don't have long term. The cancer risk appears to be pretty low, and with dip, it was definitely very. I mean, I knew people that got mouth cancer in years, like just a couple years. So I think there's big benefits on the mouth cancer, and then I mean, I drink coffee every day, and it is an exploration. I think there's got to be science. I don't necessarily think it should all come from HHS. It's just like there as this becomes more popular, we need to figure out whether it's more like caffeine, whether
Yeah.
it is a potentially safe thing you can do for a long period of time. But no, definitely Tucker is a very good evangelist for it. I'll
He
say
is.
that.
He is. I did crowdsource a question that I wanted to ask you. I was asking all my friends before we did this interview what they most wanted to know. And the question was, why does the secretary wear jeans when he's in the gym? Do you know?
Well, he answered this recently.
Did he really? I didn't see this.
He did answer this. There's still a lot of chatter about this. He said that he goes hiking often, and this is true in LA. He takes a hike before the workout, so he just rolls into the workout with the jeans, and that is how.
unreal.
And he kind of got used to it. There's a lot of conspiracy theories out there online, but that is his. That was his official answer.
Okay. I just thought it was like a cool vibe.
Yeah, it's a good.
like
I think that's maybe part of it. It's a very unique,
jeans in the squat rack.
it's a very
hard
unique.
move.
It's a very unique. Yeah, they must be stretchy jeans or something. I don't know.
Yeah.
But it is a good vibe.
Well, this is my last question. What are the things that you guys are most excited about moving forward in the next 3.25 years?
Yeah.
To be taking a look at.
Yeah. I mean, I'll take it from like thinking about going into the midterms of just a 2-year chunk of the first 2 years of MAHA, and then after that. So I think we're going into the first 2 years with credibly the most significant reforms to our food and healthcare incentives in modern American history. So in the first year of the Trump administration, we will have reformed SNAP to take soda and candy off of SNAP, which is something that was the number one goal of the food industry to prevent. And we are shifting tens of billions of dollars a year of food incentives from soda to healthy food. We are going to have reformed food labels. So next year, every food label in America is going to be totally reformed, more transparency for customers. We are at the final stages of the dietary guidelines, which are going to be revolutionary. The dietary guidelines still have the legacy of the food pyramid, recommending essentially carbs and sugar as top items. Under President Biden, he said ultra processed food is the same as whole food. It can be healthy for kids. The previous guidelines recommend added sugar as a healthy part of a 2-year-old's diet. It's very conservative, very ideologically consistent with all of us. We should have the truth in scientific guidelines. The other thing about that document is it flows to schools, it flows to military, which is having a recruitment crisis because of obesity and chronic disease. It flows to prisons, it flows to federal. There's a lot of procurement that comes from that, which is why it's so heavily lobbied on, but it's kind of evil. They're lobbying aggressively to recommend basically more sugar to kids so that schools can serve more sugar. That's bad public policy. We're going to transform the dietary guidelines. Um, and I think together with an ultra processed food definition, where we're finally going to define ultra processed food, which is more technical but really important, and what we've done on food dyes and the GRAS standards, which is closing loophole where the food industry can self-regulate what's in the food. I think that's pretty much the items that any food advocate from the left or the right for the past 20 years would say should be top of the list. And we're getting that all done in the first year. I think another huge accomplishment, which is going to come through with this autism study, they've been talking about that a lot, how Bobby Kennedy is going to have, the solutions for autism. The media's been kind of derisive about it. It's going to actually be I'm very excited about this announcement. Jay Bhattacharya, the NIH, has been hard at work. And what it represents to me is the NIH has been an orgy of corruption, an orgy of kind of an appendage of the pharmaceutical industry. They're being focused on answering like core questions. They're marshaling this $50 billion budget to actually, like, why are people getting cancer? How can we actually reverse cancer? Why are so many people getting Alzheimer's, diabetes? How can we actually reverse the root cause? Like, these are actually questions that have not been asked, and they've actually been diving in. What are the mechanisms that's causing this increase in autism? So it's not going to be, it's not going to be the golden ticket answer to everything. That's not science. But I think they're going to advance the discussion on autism in a very profound way with that announcement. It's going to represent how the NIH is getting back to gold star science. And I think, I honestly think on the innovation side, MAHA is not just fully anti-drug. Again, it's informed consent, but Marty is totally transforming the FDA. And I think we're going to see a lot of innovation come out of the FDA. So I think we're going to have a really positive agenda to run on. But again, it's that plus I think an average voter is just waking up to these issues. And I believe that the Trump administration should be getting credit for this cultural awakening that's undeniably happening in America, and the cultural awakening where people are just choosing to buy more local, to think more about their food, to snack less, which is happening. Snacking has gone down 7%. All the big junk food companies their stocks are down. I mean, they're gonna have to respond, and I think that's a good thing. That's just the market. I think that's a good thing. So I think the administration and Republicans who are leading on this issue are going to get credit for that, and this movement's going to continue.
Yeah. Well, where can people find you keep up with all the important work you're doing? Maybe plug your book.
Well, the book's Good Energy, and that's really just a personal, if this resonates with personal tips, from Casey, and it gets into the systemic issues that I talked about. But that's just been amazing. It's been about a year and a half, and just been amazing to see the response to that. And then Twitter and Instagram at Calley Means, and I'm on Twitter really just trying to go to war for the president and for Secretary Kennedy. I'm so just inspired by this administration. To me, it's unleashing a very messy, complicated conversation deliberately. This is a complex, messy conversation that you are going to inevitably, if you open this, have the leading scientists in the country declare that this administration is causing death to kids and war. I mean, that's a given with this, and they have opened that conversation deliberately. They knew they were going to take attack after attack, be, accused of slaughtering children, but they know they're doing the right thing, and they're leaning in and they're encouraging this conversation. I think every American should give the administration credit for that because it's inevitably messy, but we're winning.
Yeah. Well, thank you very much for coming on Moment of Truth. This was great.
Thank you, sir.
Thanks for joining us for another fantastic episode of Moment of Truth. And thank you to Calley and his team for making his schedule work to be here on our sweet little podcast we've been doing for 4 years now, which feels insane. Make sure that if you're not already, go follow Calley on thegreatx.com and go check out his episode on the Tucker Carlson podcast. It was sort of my entree to all the MAHA stuff. I didn't really know a lot about it ahead of that episode. It was really fantastic. I've listened to it once or twice since to get my bearings on this stuff, so would highly recommend it. Thank you very much for joining us for another episode of Moment of Truth, and we'll see you next week. Moment of Truth is an American Moment podcast taped at the Conservative Partnership Campus Studios and is produced by Jake Mercier and Hunter Smith, with original graphics and title cards by Jared Cummings. Our intro song is A Minor Struggle by Ryan Serenich, and our website is AmericanMoment.org.